We tend to have this misguided belief that if you're sued, therefore you must be a poor physician, or at least have been a poor physician on the occasion when you took care of that patient. And I think that it's just not true. I think it's important to realize that our mentors, our heroes in the world of medicine, those people are also getting sued. There's amazing people you hear about who responded to things like the Boston Marathon bombing or the Pulse nightclub shooting or the Las Vegas shooting. Those people probably also on some other day are being sued.
Welcome to the Licensed to Live show, where professionals, doctors, champions, VIPs, attorneys, and those in public office discover strategies that help you restart and gain what is lost when you find yourself accused. If another has doubted your integrity, questioned your credentials, or caused your actions to come under scrutiny, you are in the right place. On the other hand, if you have never felt the knot in the pit of your stomach when legal papers are served, the heartbreak of disappointing your family when the lock clicks shut on handcuffs, or had to appear before a board of review, then be aware, the longer you serve, the more likely you are to find yourself under the microscope of those who judge. Prepare yourself for this uncomfortable possibility. Now, here's your host, Dr. Jarrett Patton.
Welcome to this episode of the License to Live show. My name is Dr. Jarrett, and I'm your host for our journey together today and every day you choose to listen to this show. If you or anyone you know has been dissed by the healthcare system, please invite them to join us along this journey. Just go to Apple Podcasts, Google Play Podcasts, Stitcher, or anywhere you get your podcasts and subscribe to the License to Live show. While you're there, please rate this episode and give me honest feedback so I make sure I provide you with the most up-to-date information about career and life changes. When I say dissed, I mean disengaged, like, this medicine thing isn't what it's cracked up to be. Too much paperwork, too many administrators telling me what to do. I just don't even have enough time for my patients. Dissatisfied, like I'm living up to my full potential, but this career just isn't fulfilling. Disgruntled, like being a doctor has taken away too much of my life. I'm in debt up to my eyeballs, and I'm upset because my work life is too full and my real life is left barren. Or disenfranchised, like I was when I had my medical license temporarily suspended. This show is not for those physicians who are happy and fulfilled in their career or who have never had a setback in their life. If you're in this category, feel free to listen, but make sure you tell a friend to join in. Today, we will be talking with Dr. Stacia Dearman, a fellow pediatrician and a coach that helps physicians and other healers who have been affected by the stress and trauma of the malpractice litigation system. We will discuss the current landscape of the malpractice environment and ways in which you can help yourself during these stressful times. Before we get started, I would like to let you know about a special opportunity coming up. I've gotten so much feedback on the podcast that I'm offering a masterclass coming very soon. So many people feel trapped in their current careers and are afraid to break out and live their true destiny. This live masterclass will give you 5 strategies to get your career refreshed and restarted despite your limitations, past failures, and unforeseen circumstances. Take your life back and register for this masterclass now at restartwebinar.com. That's restartwebinar.com. Welcome to the License to Live show, Dr. Dearman. I'm so happy that you've taken the time out of your busy schedule to discuss this important topic that affects so many physicians. But before we get into the heart of our discussion, I noticed that while reviewing your profile, we share something in common. You, too, are also a graduate of the Case Western Reserve University School of Medicine. I had many great years there. And as a fellow pediatrician, it just brings back fond memories. So I'm glad that we share this common bond.
Yes, thank you. Thank you for having me, Jarrett. And it was a wonderful school of medicine. I'm proud to be an alum.
Excellent. It's a great club to be in, I have to say.
Yeah.
So tell me what led you into pediatrics?
Oh my goodness. I think I always knew that pediatrics was the field for me. I was a highly sought after babysitter starting at about the age of 11. And even then I enjoyed children younger than myself. And to this day, I love my young patients. I think you have to be cut out for it. My colleagues I practice in pediatric emergency medicine, and my colleagues who practice in adult emergency medicine, I think are frequently scared by the babies and the little kids. And they just don't scare me. I'm a little more afraid of a person with the medical complexity of a 90-year-old. So I think we're called to it, right?
Credentials verified.
Absolutely. I think it's something that runs within us. And for me, especially, I didn't know that I was going into pediatrics until probably my fourth year of medical school. And that's when it really struck me that pediatrics was the place. And it was in front of my face the entire time, but I just didn't see it because I was so excited about the whole career. But when you look back and think about deep within your heart, it's there, and pediatrics has always been there. So yet another great bond we share.
Yes, absolutely.
One question that I often ask many of my guests on the show is, have you ever been dissed at any time during your career?
Oh, no, not another test.
Oh, I like that theme that you use. I think for me, the words that come to mind are a little bit different. I think about feeling disheartened or discouraged, right? Even disturbed or disrupted by the experiences that I had that bring me to the coaching work that I do. I coach people around the experience of malpractice litigation because I've been there myself. And I think it breaks the heart of many physicians. In many cases, litigation arises because there was an unforeseen, painful patient outcome, and that breaks our hearts. And then, in addition, the litigation is just very, very tough. So it can really leave us feeling like we just don't quite have the strength of spirit we came into medicine with. And it takes time for that to heal, I think. And time, not just time and intention. It's an active process. Much easier, I think, to take the path of least resistance and just lose heart altogether and move on.
You're absolutely right. I mean, malpractice suits tend to be one of the most feared actions in a person's career. Chances are that a physician will be sued for malpractice, whether at fault or not. And those chances rise the longer that you practice. So There's a lot of pain and suffering that occurs when a physician gets in a malpractice suit. In fact, these suits can be career changing for some. What trends do you notice within your coaching practice regarding malpractice suits?
Oh, no. Judgment.
Well, I mean, certainly what you're saying is absolutely true, that the data is out there to confirm that most American physicians will be sued at some point in their career. And in some specialties, it's more than once. That's the norm. So I've read that among emergency physicians nowadays, it's about once every 5 to 8 years. Many surgical specialties, it may be about once every 5 to 7 years. And then even the less frequently sued specialties like general pediatrics, for example, or pathology, while they may only be sued once, and some of them may escape it, but most will be sued at some point, they're the groups who tend to have higher rewards when an award occurs. So I think we tend to have this misguided belief that if you're sued, therefore you must be a poor physician, or at least have been a poor physician on the occasion when you took care of that patient. And I think that it's just not true. I think it's important to realize that our mentors, our heroes in the world of medicine, those people are also getting sued. There's amazing people you hear about who responded to things like the Boston Marathon bombing or the Pulse nightclub shooting or the Las Vegas shooting. Those people probably also on some other day are being sued. I think it's important to recognize that it is happening. And when it happens to us, we're just not alone as much as we may feel isolated and alone.
Fire starters, I want you to hear this, because this is the assumption that's made time and time and time again on us, that the assumption is that if you're named in a malpractice suit or involved in a malpractice suit, that you are a poor physician or poor quality physician, or you practice unsafe medicine. And deep down, this is not the case. However, as Dr. Dearman states, that there is some isolation and you feel alone in this process, but you're not alone. You heard those statistics that she said, that people almost cyclically get sued in some of these higher likelihood to be sued specialties. And even the ones where it doesn't happen very often, like pediatrics, it still is set up to make you feel isolated, or perhaps shatter your confidence a little bit. So can you speak a little bit more about how this may affect your confidence?
It affects our confidence profoundly. And I think one of the primary reasons why that probably happens is that so many of us as physicians identify so strongly with what we do. So we don't view it as something we do. We view being a physician as who we are. So when this bad outcome occurs and we're litigated against, we take it as a reflection on our value as a human being, not the value we provided to a customer on a given day. It doesn't feel like a breach of contract to us. It feels like it's a reflection on our value as a human being, which I think is one of the reasons why peer support is so important, because we need to hear from another physician on the process, right? People in other professions, I don't think they fully understand how profoundly it impacts us, how profoundly it impacts on our sense of self. Does that make sense?
It absolutely makes a lot of sense. And unfortunately, and we've talked about this on the show before, that we as humans almost equate to we as doctors. So they're one and the same, and we have difficulty internally separating it from each other, so that, the father, the husband, the person that likes to spend time with his kids is different than the pediatrician who will go out and take care of kids and oversee vaccinations, for instance. But sometimes those things feel so intertwined that it feels like you are reflecting upon yourself as a human rather than just the professional side of you.
That's right. And I think at some level that personal commitment we have to our work and to our patients is not all a bad thing, because the work we do has its difficult side, it has its unpleasant side. And it's good that we take pride in the contribution we're making to society, good that we take pride in how we do what we do and what we mean to our patients. It's just that personal commitment sets us up for pain when something goes wrong, right? Doesn't mean we should abandon the personal commitment, but I think we have to acknowledge its meaning for us, its meaning at a personal level or spiritual level. So,
absolutely. I don't think that we could do what we do as physicians without having that personal commitment. And I think that would entirely change healthcare if we didn't have that personal commitment. So acknowledging the fact that it is important for what we do is perfect and great advice, Dr. Dearman. I also would like to go back to something you said too about the peer support, because peer support is incredibly important when people are having any kind of trauma within their career, for instance. And it really takes someone who's been there to really understand what it's like. And so if you've been named in a malpractice suit, having a trusted advisor, somebody that you can really count on, that knows, that has been there and is able to understand what it feels like, really goes a long way. And it's really important, fire starters, for you guys to know that there are people out there. And even if you are going through a malpractice suit right now, you're not alone.
Right. I think there are kind of a couple pieces to that. Number one, in my growth as a coach, I've heard from people that maybe they've reached out to a psychologist or other professional for support, and on some occasions have found that person really didn't seem to be able to intuit how they were feeling about what was happening. So I think that what you're saying is very true, that it's helpful to us to connect with somebody who knows what it's like. I sometimes compare it to something like a diagnosis of breast cancer. There was a time when people didn't talk about that, right? But just think of all the good it does women with breast cancer, that there are now so many supports out there for them. If a woman comes out with the fact that she has breast cancer, immediately 5 or 10 women are going to crowd around her and say, I have been there. Well, I think as physicians, we need that peer voice. Another way I would look at it is, if we think about, let's say, someone working in the realm of surgery. Well, if a person practices surgery, complications are given, right? The complications cannot be entirely avoided if you're going to actively practice surgery. So in the context of the training of a surgeon, a young surgeon is taught how to avoid complications, and ideally they are taught what to do when a complication arises. Well, I think around malpractice, that's the approach we need to be taking now. We need to be teaching each other how to minimize the risk of litigation. And there also needs to be a space to say, and how do I help you when litigation arises? So that it's understood that chances are it will arise. We want to keep it to a minimum, but we don't want to pretend it's not a reality. Just like pretending surgical complications aren't a reality would just be wasteful.
I think preparation could be one of the best things, and maybe anticipation, because I want you to understand, for those of you that are continuing to practice and maybe have never been named in a suit, again, the chances are very likely that you will be at some point in your career. So tell me, what can a physician do to minimize the traumatic effects on themselves during the course of a malpractice suit?
We've already hit on one, which is that you've got to find somebody to connect with, and you want to be thoughtful about how you go about that. So one of the feelings that I think most hovers over people like a cloud in the context of malpractice litigation is a sense of feeling ashamed, right? And there is lots of research now, and the voice of Brene Brown, very, very clearly heard in society, that the cure for shame, or the way to heal shame, is through connection with someone who's earned the right to hear your story. So I think for many of us, that may partly begin with connecting with a peer we respect. We may need to connect with our medical director, but if you doubt that your medical director will provide you sincere and honest support, you may want to connect with them at one level and connect more deeply with someone else who you trust to honestly and sincerely support you. I think one of the benefits of something like a coaching relationship in this situation is that a lot of times when we go to peers for support, sometimes I think what happens is that people end up hearing the peers' war stories, and it doesn't make them feel better. They end up sort of re-traumatized hearing about all the bad outcomes that have happened to everybody's patients. So that could be maybe a benefit of coaching, is that you've got somebody who's step apart and has hopefully processed their own experience enough to be able to focus on your experience. I think the peer support is key. And then I think the other thing is that people will need to seek just personal support. There are stories you hear about physicians who've gone through litigation and haven't revealed to their spouse that they've been sued. Can you imagine what that does to a marriage? It can't be good. Or they're afraid to let their children know. So I think there's that piece of things, that we have to find ways to find words to tell the people who care about us what's hurting us. There may be some details we share with some people and some we would share with others, but finding those connections, I think, is key.
I just know that there are a lot of people out there listening right now, and they're going through this. And by the time you get that certified letter coming through the hospital, or the risk management people call you to set up a meeting with you, the amount of shame, I think, is one of those things that is a great descriptor, because even though you may know the case, you look at the case and you say, well, there's nothing wrong here. it's a cloud, as you described, and it hangs over you and it hangs over you and it drags on for such a long period of time.
Yes.
Getting a little bit of peer support is incredibly important, and getting that personal support is amazingly important. And this is the time when you really have to reach out to those family and friends and know that you need that support during that time, because as simple as these things can seem conceptually, the reality is that they play out over a long period of time.
Right.
So from the time you get that first notice, months and months may pass, and very likely maybe even years may pass before there is some sort of final resolution, which could mean that you're dropped from the case, or it could go all the way into the court system. But at any rate, you have to have these support systems around you at all the time. So whether you're getting peer support, whether you're getting personal support, please tell your spouses and really share some of that pain. As painful as it is, you're going to need to get that support. So I think that's great advice.
I think the arc of the story even extends out longer than from that letter to like a verdict from a jury, let's say. The arc really begins with the unfortunate patient outcome, right? And for some people, that unfortunate patient outcome raises no questions in their mind that their care was good. Other unfortunate patient outcomes for other people raise huge questions about their practice and so forth. And I think for that person who's feeling devastated by that unfortunate outcome, they will be better off if they seek support then and there. I think it's less likely to morph into PTSD, anxiety, and depression if they begin to get support around the unfortunate outcome, whether or not they're ever sued. And then if we go out to the other end, I know from personal experience exactly what you're describing, that it was 3.5 years from the time of the outcome to the time of the jury verdict. Well, I can tell you, the fact that the verdict went in my favor does not mean I went home singing hooray and hallelujah. I was still hurting, and it took time to recover at the back end. So I think for people to acknowledge it's a long arc. On my blog, I've compared it to a marathon. It is a marathon, and it's not just a marathon. It's like one of those ultra marathons across the Gobi Desert, right? Like 6 weeks of marathon running. And I think it's best for people to know it's a marathon, and no one can tell you at the outset how many miles the marathon will go. And furthermore, you didn't volunteer, right? You didn't sign up for this. It came to you.
You're right. And there's not really great training for this. It's something that often can catch you off guard, and these unfortunate outcomes. And I love the way you describe that as an arc, and that arc encompasses. And I agree, those effects of the trauma linger well after the verdict. And even in my case, having a verdict in my favor, you don't feel like celebrating because you've gone through so much pain and suffering. And perhaps you even knew what the outcome was going to be all along, but it's still something that hangs over you and it drags you, and it takes time to heal. I want everyone to hear that. It takes time to heal from a wound or an assault like this. And you're right. I'm sure, although I've never run a marathon, and I don't know if I'm going to sign up for one anytime soon, but I do know that I would probably be sore after running a marathon, and my muscles would need some time to heal, and probably my feet may have some blisters. There's probably a whole bunch of things that would be wrong with me at the least. And just as this arc that goes on, and for Dr. Dearman's case, 3.5 years, that's a long stretch of your life to be going through a singular ordeal. Meanwhile, you're trying to continue to do other things on a day-to-day basis, and you're experiencing this trauma that takes you all the way through. So I appreciate that analogy. I think that point really drives it home.
Yeah. Yeah.
Well, where can people find more out about you?
Well, I have a website, and the web address is www.thrivephysician, all one word, ThrivePhysician.com. And that is the home on the internet for my business, which is called Thrive Insight Education Support. That's the space from which I do my coaching and my public speaking and provide education and support. I have a blog there that has posts related to the personal side of this process, posts related to the legal side. It's an ongoing endeavor on my part, and people can easily reach me through a contact form that's on the website. They can email me from there. The emails come directly to me. I think a lot of people have fears around confidentiality if they're reaching out to someone about such a sensitive matter. And I just want to assure them that if they send an email to that web address or submit that contact form, I will be the one to open it.
Excellent. So everybody go out and check out thrivephysician.com, because that is a really great site. I've checked out her blog. She has some great writings up there. There's a lot of great information to know. And if you need help in this area, you can reach out to her directly through her website. So that's a great resource available for everyone today. I would like to thank you, Dr. Dearman, for being on the License to Live show today.
Thank you so much. It's really been a delight to talk with you, Jarrett.
We have learned so much more about this process and some about your journey. And most of all, for everyone out there, you are not alone in this process. Is there anything else you would like to say to our audience today?
The comeback.
I'd just like to reinforce a theme that I know is a common theme for you, which is that hardships come into our lives. We can become a better person as a result of them. You and I were talking earlier about one of my brother's favorite quotes, which is that a setback is a setup for a comeback. And believe it or not, I think that's even true with something as ugly as malpractice litigation. So just keep your conscience about you, keep your integrity about you, reach out to people who can support you, and have faith that if you keep putting one foot in front of the other, you're going to come through this.
Licensed to Live.
What more can I say? That was incredible. And that sums it up. If you guys are going through difficult times, just know that your setback is setting you up for your greatest comeback, and just keep moving forward. I can't say it better than that. Thanks again, Dr. Dearman, for coming on today.
Sure. Thank you for having me.
Remember, fire starters, if you or anyone you know has been disengaged, dissatisfied, disgruntled, disenfranchised, disheartened, disrupted, disturbed with healthcare, please invite them to join us along this journey. Simply go to your favorite podcast distributor and subscribe to Licensed to Live. And while you are there, please rate this episode and give me honest feedback so I can make sure I provide you with the most up-to-date information about career challenges and life changes. And don't forget to sign up for your free Career Restart webinar at restartwebinar.com. See you next time.
No matter how disheartening the moment of accusation sounds, how deep the pain of immobilization stabs, or how bleak your future looks, no one can take away your license to live. Keep Dr. Jarrett's expertise handy and unlock your future. Go to Apple Podcasts, Google Podcasts, or another podcast player and subscribe right now to Licensed to Live. See you next time.